difficult. So you can put them in a lithotomy position, which is basically how do they deliver a baby, that particular position, where in which they lie down supine, hips are flexed, knees are flexed, with the feet on the floor, you can, not on the floor, on the mattress, and then you examine the patient. So these are the two positions that you can put the patient in. Once that part is done, then request the patient to expose the region, and then we start the procedure. Are we okay with this, guys? So these are the prerequisites that you have to follow. Is that okay? Cut. We go to the third video. Okay. Stop and then we go. Why am I saying that is they wanted small things, so it will be of use, they said. Okay, guys, we go to the third segment. Now, ask the patient to expose. Patient gets, or you expose it. Now, first thing that I want you to be on this segment. Guys, please be on this side. First of all, you make an assessment of the skin that lines the perineum and anococcygeal region. That lines the perineum and anococcygeal region. What are we looking for? First of all you need to, I said you need a good source of light rather than a torchlight, something like a focus light. If it is there, it is very good. Bend down, visualize the skin. Again, the skin that lines the perineum as well as the gluteal region. Are we okay? Now, what are we looking for on the skin? In the skin, you are looking for any signs of inflammatory changes, any scars in this particular region, any kind of redness in this particular region. Apart from that, excoriation of skin or a fungal infection signs in that particular region. Are we okay? That is one. Once that part is done, using your left hand, lift the cheek of the right gluteal region and expose the anal aperture. Are we okay? Again, I repeat. Earlier, it was only this segment that we are visualizing, which is the skin. Step 2, leave your left hand, heel of your left hand, thenar, hypothenar, eminence on the gluteal region. Lift the cheek of the gluteal region, expose the anal aperture. Is that okay? Now, in the anal aperture, we are looking for certain things. Anal fissure, whether there is a cut in any of the anal aperture region, whether there is a sinus, which means there is an opening in any particular region of the anal region. 3, is there a polyp that is hanging out of the anal region, or there is a prolapse of a rectum that comes, prolapse, descent of a rectum from above downwards through the anal aperture. Is it seen or not? Apart from skin tags or warts. Is that okay, guys? Besides, so for which what you have to do is lift the cheek, visualize through the anal aperture. Is there a fissure? Is there a fistula? Is there a polyp? Is there a hemorrhoid? Is there a prolapse of the anal canal? All that needs to be visualized. Is that okay? Third step, ask the sometimes fistulas, fissures, prolapse will be inside the first segment of the anal canal. It doesn't pop out through the anal aperture. What do? Ask the patient to strain like how he is going to pass motion, and then while lifting the cheek, third segment, ask the patient to strain like how he passes motion. Again, make an assessment whether the fissure is visible clearly, fistula is visible clearly, is the polyp if present is visible clearly, prolapse of rectum is it visible clearly. If none, say it is none. Okay, third step. Guys, are we okay? 3 steps. Make an assessment of the skin. Step 1. Lift the gluteal cheek. Make an assessment. Number 3. Ask the patient to increase the intra-abdominal pressure and strain so that certain structures which are inside the anal canal kind of pops out for you to visualize through the anal aperture. Are we okay, everybody? Once that part is done, now we'll have to insert the finger, which is the 4th step. So all you have to do now, take good amount of lubricant and you smear it only on your index finger. Is that okay? Smear it well on your index finger. Now, one more thing that I missed. In case, while you're doing step number 2 and step number 3, patient has a fissure, patient has a fistula, patient has a prolapse, all you have to do is remember, whichever hand that you're placing, usually you'll tend to have a watch in this area. I forgot to wear my watch. Now, if you see the watch, if it is here, where is the 12 o'clock of the watch? 12 o'clock, it is here. Where is the 6 o'clock in the watch? More towards the coccygeal region. Where is the 3 o'clock? More towards the left limb, which is in contact with the bed. Where is the 9 o'clock? Which is the other cheek. With reference to the clock system, you will have to say, in 12 o'clock I see this, between 9 and 12 I see this, in 6 o'clock I see this, 9 o'clock I see this. Something like that needs to be done. You cannot choose any other portion, but when you are referring to the clock, you must say the position of the fissure, position of the fistula, position of the prolapse, position of the hemorrhoids. Is that okay, everybody? That is how we demarcate from now on. Any finding is represented by the clock mechanism. Are we okay? Right? Now lift the cheek, visualize the anal aperture, and gently from the coccygeal region, guide your finger into the anal aperture. Remember, the first segment when we are inserting the finger, always insert only the first digit. When you insert the first digit, it will go into the first segment and the second segment. Are we okay? At that time, you have two blocks of external anal sphincters, isn't it? Moment you put the finger in, patient will feel that they don't have any control over the anal sphincter. They feel like passing motion. Don't quickly take your hand off. Leave the finger there. Reassure the patient that he or she will feel like passing motion. Take a deep breath and continue to follow certain instructions that you give. Is that okay, everybody? So the first step, insert only the first digit. How do you insert? If it's a female patient, you will have to be extremely careful. Always visualize the anal aperture and then insert. When you're standing stiff and you're blindly inserting, by default, it can find its way into the vaginal aperture. Be very careful. That is why when you start doing a rectal examination, leave the finger close to the posterior part of your rectal anal fissure and then guide it into the anal canal. Guys, are we okay? Fine. Now let me take a bit of, it's already dried up. All right, guys. So any change that you see must refer to the clock mechanism. Is that fine, everyone? Now, first I said insert the first digit, lift it, visualize the anal aperture, talk to the patient and tell them that I'm going to insert the first digit. Just stop, reassure the patient, don't worry, you may feel like passing motion, don't have to worry, take a deep breath and continue to breathe slowly and take a deep breath. Now at this time, with the first digit there, you're supposed to assess the tone of the external anal sphincter. How do you assess? Ask the patient to squeeze your finger using the muscles of the anal canal. Like how you defecate, can you squeeze my finger using your anal aperture? Patient will squeeze and you assess the tone of the anal sphincter. What will happen? There will be a kind of a grip, kind of a feeling from all sides when the patients defecate. It's something like when they want to stop defecate, what happens? It just grips like that, isn't it? Same thing, you'll feel a grip and you need to say external anal sphincter tone is fine. Are we okay? Now, with the palmar surface of the finger still facing you, push the rest of the finger through and through. Now, all you have to do now is, with the finger there, you can only run the finger rather than twist and turn at the level of the wrist nor the elbow because it is extremely painful. Are we okay, guys? So, all you have to do is with the finger facing towards, again clock, palmar surface of the finger is the one that assesses everything, nor the dorsum nor the sides. So, where's my palmar surface with respect to the clock? 6 o'clock. 6 o'clock towards me. There, I must be able to feel the fold of a mucous membrane because I've already reached the third segment. I'm at the junction of the anorectal region. That is where the tip of finger is. When I move my finger from about downwards at 6 o'clock, I'm looking for fissures, I'm looking for a fistula, I'm looking for a polyp, I'm looking for an hemorrhoid. If it is there, I say at 6 o'clock position, this is what I feel. If not, what normally will you feel in the upper segment of the anal canal? Columns. Are we okay? Fine. So, you run your finger. Now, turn the finger to the 9 o'clock position. Are we okay? Turn your finger towards the 9 o'clock position. Move your finger there and say, do you feel the anal columns or not? Apart from anal columns, is there any internal hemorrhoid? Is there a fistula? Is there a polyp? Is there a fissure in that particular area? Third, run your finger to the 3 o'clock position. Move your finger the same, palmar surface over the mucosal, anal mucosa. Feel for the fissures, fistulas, polyps, hemorrhoids, besides anal column, which is normal. Last one, turn your finger, push your finger further up. You will feel for fissures. You are looking for fissures, polyps, hemorrhoids in that particular region. Usually you tend to have folds normally. Now, when you push your finger further up to the anterior, if it's a male patient, you will feel for a prostate that lies anterior to it. Usually you feel for the prostate and you must say whether the prostate is enlarged or not. Usually when you feel the prostate, it will be smooth on the back. Usually you are looking for whether there is smooth or there is a depression between two elevations on the prostate. If there is a depression between two elevations on the posterior surface of the prostate, prostate is normal. If the depression is missing and it is smooth throughout, prostate is enlarged. Are we okay, everybody? Guys, are we okay? Apart from feeling for the fissures, sinus, hemorrhoids in that region and anal columns, move your finger further up, feel for the prostates, feel for the posterior surface, feel for the sulcus. If there is a sulcus between the two elevations, prostate is normal. Guys, are we okay? Last step, the finger inside and the thumb outside, try to pinch them together, which we call it as bimanual palpation, to look for any mass in the region that surrounds the anal canal and rectum, which is called as ischiorectal fossa. If there is no mass, done, take your finger off. Look at the glove that you have. At the tip, if there are some cellular debris, if there is blood, if there is mucus in that particular tip of the finger with the glove on, remove the glove and send the glove for investigations. If there is none, you can discard the glove. Are we okay? Now, give a couple of tissue papers for the patient to wipe. Tell the patient you can go to the washroom, wash yourself, change yourself into normal clothes, come back again, and I will share the findings with you. Is that okay?